Hello and welcome to another Shorts in Psychology. In today's video, we're going to discuss cognitive behavioural therapy, or CBT, and some of its many applications, in particular to treat anxiety and depression. Cognitive behaviour therapy, or CBT, is an effective treatment approach for a range of mental and emotional health issues, including anxiety and depression. CBT aims to help a person identify and challenge unhelpful thoughts and to learn practical self-help strategies. It is based on the understanding that thinking negatively is a habit that, like any other habit, can be broken. The main focus of CBT is that thoughts, feelings and behaviours combine to influence a person's quality of life. For example, severe shyness in social situations may come from the person thinking that other people will always find them boring or stupid. This belief could cause the person to feel extremely anxious in social situations. This could lead to certain behaviour in social situations, such as trembling, sweating, accelerated heart rate, or other uncomfortable symptoms. The person could then feel overwhelmed with negative emotions such as shame and negative self-talk such as "I'm such an idiot," and their fear of social situations could become worse with every bad experience. CBT aims to teach people that it is possible to have control over their thoughts, feelings and behaviours. It helps the person to challenge and overcome automatic beliefs and use practical strategies to change or modify their behaviour. The result is more positive feelings, which in turn lead to more positive thoughts and behaviours. So how does CBT work? As already mentioned, CBT focuses on changing unhelpful or unhealthy thoughts and behaviours. It is a combination of two therapies, cognitive therapy and behaviour therapy. Cognitive therapy aims to challenge and overcome automatic beliefs, and then behaviour therapy involves teaching the client practical strategies to change or modify their behaviour. The basis of both these techniques is that healthy thoughts lead to healthy feelings and behaviours. Let's look at each of these two therapies in a little more detail. The aim of cognitive therapy is to change the way the person thinks about the issue that's causing concern. Negative thoughts cause self-destructive feelings and behaviours. For example, someone who thinks they are unworthy of love or respect may feel withdrawn in social situations and behave shyly. Cognitive therapy challenges those thoughts and provides the person with healthier strategies. Many techniques are available. One technique involves using a thought diary to identify thinking patterns which make them feel unpleasant. Faulty patterns of thinking that are self-defeating are called thinking errors. They occur when the things you are thinking do not match up with reality. Some common thinking errors include all or nothing. This is when you see everything as black or white with no in between. If something isn't 100% perfect, then it's a total failure. Overgeneralization is when you see one event that didn't turn out so well as part of a never-ending pattern of failure or disappointment. The truth may well be that the incident was an isolated event, and if you put it into perspective, it probably isn't that bad at all. Mind reading is when you decide in your mind what other people must be thinking, without checking the facts, and then you act on that incorrect assumption. Fortune telling is predicting that things will turn out badly, even if you have absolutely no proof that this will be the case. This thinking error can lead to real problems because if you think things are going to go wrong, then you may act in a way that allows them to go wrong. Magnification is also known as blowing things out of proportion. It is when you make one little mistake and it becomes so huge in your mind that it spoils everything else in your day. Minimization is the opposite of magnification and is when good events are downplayed because you are too focused on any aspect of the event that went wrong. Finally, catastrophizing is when you make extreme judgments and imagine the very worst outcomes will occur, even if there isn't a scrap of evidence that they will. Once thinking errors have been identified, more balanced thinking is developed by looking for evidence to prove or disprove these thinking patterns. For example, someone who believes that they are unlovable may be prompted to acknowledge the family and friends who love and respect them. This evidence helps the person to realize that their belief is false. This is called cognitive restructuring. Here is an example of cognitive restructuring. Someone who is trying to lose weight and gains half a kilo one week may automatically experience thinking errors such as overgeneralization. I will never be able to lose weight. As a result, they will reduce their efforts. Cognitive restructuring will involve replacing this with a more functional thought, such as, this is just a setback. It's difficult to lose weight, but not impossible. I've done it before. The person learns to identify and challenge negative thoughts and replace them with more realistic and positive thoughts. This in turn will influence their behaviour, leading to a more positive consequence and increasing their efforts to lose weight. Finally, the person can be taught new skills such as positive self-talk, distraction, and problem solving to help promote more rational and positive thinking patterns. The aim of behaviour therapy is to teach the person techniques or skills to alter their behaviour. This often involves activity monitoring in order to link the person's activities, thoughts, and feelings. For example, a person who behaves shyly at a party may have negative thoughts and feelings about themselves. They may also lack social skills. Behaviour therapy teaches the person more helpful behaviours. For example, they may be taught conversational skills that they practice in therapy and in social situations. Negative thoughts and feelings reduce as the person discovers they can enjoy themselves in social situations. Behaviour therapy can also involve other techniques such as facing fears and breaking tasks into smaller, more achievable steps. CBT is used to treat a range of psychological problems, including anxiety disorders, depression, low self-esteem, anger and stress management, eating disorders, child behaviour problems, and insomnia. It has been practiced widely for more than 30 years and researched extensively in rigorous clinical trials. CBT is flexible, individualised, and can be adapted to a wide range of individuals and a variety of settings. Furthermore, CBT can be as effective as medication to treat depression and anxiety. Its application varies according to the problem being addressed. So let's now look at how CBT can be used to treat anxiety and depression specifically. Everyone experiences anxiety sometimes due to specific things or circumstances. It serves as a means of protection and can increase our performance in stressful situations. For example, the rush of anxiety that often occurs prior to a job interview or a big race often can enhance our performance. But for some people, the feeling of anxiety is more general, meaning that you feel constantly on alert or fearful no matter what activity you are doing. This can be extremely distressing and get in the way of daily life, as misinterpretation of the threat and subsequent anxiety can lead to coping via avoidance. This then negatively reinforces the anxiety and misinterpretation of the threat, as it removes the anxiety reaction. In CBT, faulty misinterpretations are addressed using the cognitive therapy component, and controlling the anxiety symptoms and reducing avoidance behaviour is addressed using behaviour therapy. Using CBT to treat anxiety involves focusing on changing patterns of thinkings and beliefs that are associated with and trigger anxiety. Common maladaptive thought processes exhibited by sufferers of anxiety that are often treated using CBT include thinking errors such as catastrophizing and magnification, as well as the individual's interpretation of fear and anxiety. Often, the individual uses their fear and anxiety as evidence that they are losing control or that death or craziness is imminent, which intensifies their fear. The behaviour therapy component aims to help clients realise that even though they may be experiencing anxious feelings, they may not be in any real danger. This could involve teaching them strategies such as risk calculation. They will also be taught skills and strategies to manage the feelings of anxiety, such as breathing into cupped hands to overcome hyperventilation and relaxation techniques. As anxiety is also usually accompanied by avoidance behaviour, the client will also be gradually and repeatedly exposed to the feared situation until the anxiety response is reduced. Let's look at an example. Someone suffering from social anxiety disorder will experience maladaptive thoughts such as, I will come across as stupid and I won't know what to say. These thoughts will cause the individual to experience physical symptoms such as dizziness, sweating and a racing heart, and emotions such as panic, embarrassment and shame. As a result, they will engage in behaviours such as avoiding social situations and excessively focusing on themselves and how they are appearing to others. Through CBT, this individual will be taught to adapt more rational thoughts such as everyone says silly things once in a while, or that they can take a breath of fresh air to help them cope if needed. As a result, they are more likely to feel calm, confident and reassured, which will be reflected by their physical symptoms. Hopefully, this will reduce their avoidance of social situations and enable them to engage in more productive behaviours such as initiating conversations and focusing on others rather than themselves. People with depression can have ongoing negative feelings about themselves, other people, and the world around them. This negative thinking pattern can become automatic so that they don't notice when their judgment is irrational or unfair on themselves. CBT can help people with depression by giving them tools to challenge the negative thoughts and override them with more realistic and positive thought processes via cognitive restructuring. The individual will also be taught to understand, manage, and change the behaviours that sustain the depression. This could include techniques such as pleasant event scheduling and structured problem solving. Pleasant event scheduling helps clients to schedule activities into their lives to increase their experience of pleasure and become more active. Although they derive little pleasure from these activities initially, and completing them may take considerable effort, with persistence it becomes easier and more pleasurable over time. Structured problem solving involves defining problems, generating and implementing solutions. This often helps individuals combat feelings of worthlessness and helplessness. CBT has many benefits, including the fact that it is flexible, individualised, and can be adapted to a wide range of individuals and a variety of settings. Furthermore, as the individual is actively involved in their treatment, they are more likely to stick with it. It also has a long-term benefit that continues after treatment, as compared to medication, where the benefit is only short-term. Once the treatment ceases, symptoms may reappear. Another advantage of CBT is that individuals can keep using what they have learned in therapy to approach other problems in life. Finally, CBT is compatible with a range of other treatments, including counselling and medication. Despite many advantages, CBT also has its limitations. CBT involves significant amounts of homework between sessions and therefore may not be suitable for people with more complex mental health needs or learning difficulties. It also relies on the patient's cooperation in practicing the skills and completing the homework between sessions. Another disadvantage is that CBT takes time to be effective, usually between 5 to 10 months, and this may be too long for individuals suffering from conditions like severe depression who are experiencing suicidal thoughts. Furthermore, as CBT can involve confronting your emotions and anxieties, you may experience initial periods where you are more anxious or emotionally uncomfortable. Finally, CBT focuses on the individual's capacity to change themselves and does not address wider problems in systems or families that often have a significant impact on an individual's health and well-being. Let's conclude by examining a few past exam questions on CBT. Pause the video for a moment and attempt this question from the 2014 SACE exam. For the first part of this question, you need to explain how CBT can be used to treat depression for 4 marks. This means you need one well-made point about the cognitive therapy component and one well-made point about the behaviour therapy component for 2 marks each. A generic description of CBT without application to depression would at most award you 2 marks. So a model answer could look something like this. CBT usually consists of helping patients identify their faulty cognitions, such as rumination and feelings of worthlessness or avoidance, recognizing that these thoughts lead to emotional distress. Cognitive restructuring could be used to challenge the validity of the faulty cognitions and replace them with more valid cognitions in order to reduce the depression. CBT would also address changes in behaviour so that they have positive experiences or consequences, i.e. increase pleasant activities or be more aware of pleasant experiences when they occur. For Part B, you could describe any of the limitations on the previous slide. In addition to these, you could also discuss the lack of effectiveness of CBT if the depression has a biological cause, such as a neurotransmitter imbalance. Have a go at this question. It is a bit different than the usual 4-mark description of CBT. So this question requires you to describe how CBT would differ for Japanese and Australian populations. You will receive very few marks for a generic statement about the fact that CBT would have to differ for the two nationalities due to differences in culture, without using any of the data in the table. Instead, you need to describe some of the faulty cognitions and maladaptive behaviours for each culture that CBT could address. For example, faulty cognitions in the Australian population could be related to loss, loneliness, and rumination. In the Japanese population, the cognitive therapy component may be used to treat beliefs relating to social isolation and dealing with emotions. Behaviour therapy approaches would also differ between populations, as it would most likely incorporate problem-solving skills for both cultures, whereas for Australians it might also include scheduling regular physical activity. Let's finish with one final question. Pause the video while you read and answer the second part of this question. You want to answer this question the same way as the first, but simply providing anxiety-specific examples rather than ones relating to depression. In this case, thinking errors you could discuss as being identified, challenged, and replaced could include catastrophizing and magnification. As the anxiety symptoms are triggered by the sound of ringing phones, gradual exposure may be a component of the behaviour therapy, as well as teaching the individual how to manage their anxiety symptoms through breathing exercises and relaxation. In summary, CBT aims to help a person identify and challenge unhelpful thoughts and to learn practical self-help strategies. It is composed of two therapies, cognitive and behaviour therapy, and has been shown to be highly effective at treating a wide range of mental health issues. CBT can also be easily adapted to suit a wide range of individuals and settings. Hopefully you now have a better understanding of how CBT works, its advantages, disadvantages, and application to anxiety and depression. Thanks for listening.